How to treat earaches with natural remedies. An earache is a painful sensation, experienced in either the inner or outer ear, that causes pains ranging from sharp and piercing to dull and achy. The pain may be experienced in one or both ears and may be short-lived or chronic. First step is to determine the cause. While the most common source of earaches in children is an ear infection, adults may experience earaches for other reasons. Common causes of earaches include swimmer's ear, otitis externa, and inflammation, irritation, or infection of the outer ear canal caused by water that remains inside the ear after swimming. Ear infections, otitis media, a bacterial or viral infection of the middle ear caused by fluid buildup behind the eardrum after an upper respiratory illness. A sinus infection. Arthritis in the jaw. Step 2. Look for severe symptoms. If an earache lasts longer than 10 to 14 days, it may be a sign of a more serious medical problem, and you should seek medical assistance. If left untreated, chronic ear infections could cause permanent hearing loss or irreversible damage to the ear canal and tissue or bones at the base of the skull. Call an ambulance or go to the emergency room if you experience seizures, decreased consciousness, severe confusion, facial weakness, loss of voice, or difficulty swallowing associated with an earache or inner ear damage, blood or discharge from the ear. Natural remedies to treat earaches. 1. Blow dry your ears. Set a hairdryer to the lowest setting and keep it at least 1 foot, 30 centimeters, away from your head. Angle your head sideways while blow drying to help facilitate the flow of excess water. 2. Avoid foods that cause inflammation. Inflammation, which is the body's immunological response to anything it perceives as a foreign object, has been linked to a number of health problems, and can be prevented or reduced by avoiding certain foods. Foods known to cause inflammation include refined carbohydrates, fried foods, soda, and other foods and beverages with added sugar, red meat and processed meat. 3. Stick to a low-sodium diet. Patients with chronic ear problems, especially Meniere's disease, should reduce daily sodium consumption to around 1,500 to 2,000 milligrams to reduce inflammation and fluid pressure in the inner ear. 4. Stay hydrated. Staying hydrated goes hand in hand with maintaining a low-sodium diet. Inner ear conditions like endolymphatic hydrops, a condition associated with changes in the quantity or pressure of inner ear fluid, can be triggered by dehydration and electrolyte imbalances. Most experts recommend drinking 8-ounce glasses of water every day to stay adequately hydrated. But depending on factors such as environment and activity, you may need to drink a little bit more. Are you facing ear problem? Which solution you find helpful must tell in comment box to help others.